Yo, 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 if you guys can hear me, let me know in the comments. Just testing out this new mic, so I want to make sure that you guys can hear me well before I start. My name is Dr. Isang, and I'm a cardiologist, and I use this platform to discuss. Perfect, Randolph. I don't want to I don't want to butcher your last name, so Randall L. Lam Lamke. I'm gonna say Lamke or Lamk. But what's going on? I hope you guys are doing well. My name is Dr. Isang, cardiologist here to use this platform to discuss things regarding the heart health and prevention. Why? Because prevention is a lot better than treatment. Prevention is a lot cheaper on you guys than treatment. Prevention just leads to a healthier and a happier life. When it comes to things like high blood pressure, when it comes to things like heart disease, if you can prevent it from happening, you can it can lead to a significant better quality of life. So today we're talking about chest pain, specifically how chest pain can lead to a heart attack, things to look out for, the risk factors for it. But when it comes to prevention, you have to think that if you know what the risk factors are for a heart attack and you treat those risk factors, you potentially prevent or even delay the onset of cardiac disease. And I say delay because some people having a heart attack may be inevitable for them, especially if they have a strong family history of heart disease. I see so many patients that tell me that their mother had a heart attack, their father had a heart attack, their parents had their siblings had heart attacks, uncles, aunts, grandparents. So those ones can be very difficult to say that you're going to prevent it from happening when they have such a strong history of it. They have such a strong proponent, strong reason for them to have a heart attack. A lot of them have underlying cardiac issues that's leading to a heart attack. A lot of them have underlying elevated, like super normal cholesterol levels. I get nervous when someone's cholesterol level is one LDL is, you know, one ideally 130, but I really get nervous when it's 150 and above. But I've seen people with LDLs in the 200s, and they tell me that their mother had a heart attack in their 30s or in their 40s. So we really want to understand that these risk factors mean a lot. These risk factors include hypertension, high cholesterol, strong family history, diabetes, smoking, and just not monitoring the symptoms appropriately, just not going and seeing your primary medical provider on a routinely basis to get these um, these risk factors checked at and treated appropriately. So um, when someone is having chest pain, the chest pain that gets concerning for someone in the cardiac field or even a health care personnel is chest pain here in the mid-sternal location. It can sometimes travel to the arm, left arm. It can travel to the jaw. But chest pain here that is worse with exertion, worse with stress, something bad happened and you have chest pain. You're walking up a flight of stairs and you have chest pain. And it gets better with rest or medication called nitroglycerin. If you have any of those, we're super concerned. We definitely want you to be seen by a medical provider as soon as possible to make sure that your chest pain isn't due to something that needs urgent attention, such as a heart attack. So, if you're having those symptoms, go and get seen, especially in the ER. So, you come to the ER and they'll run some tests on you. One is a troponin. If the troponin is elevated, boom, you should be getting a heart catheterization, especially if the troponin is elevated, you're still having chest pain, and EKG is showing a heart attack. They're rushing you to the cardiac catheterization lab as soon as possible. Some people, their chest pain wax and wanes, so by the time they come to the hospital, the chest pain is pretty much non-existent. So for those individuals, we can potentially do a stress test on them to kind of help risk stratify whether they should need more evaluation, such as the heart catheterization versus medication changes and lifestyle changes. So um, if the stress test is abnormal, boom, you go and get a cardiac catheterization to make sure that your chest pain isn't due to a blockage that needs to be opened up. So let's say the stress test is normal. So we can also do an echocardiogram, an ultrasound of the heart. Lets us know how well the heart's squeezing. If the heart is not squeezing as strong as it should, if it's the ejection fraction is low, the squeeze function, then we definitely want to make sure that that's not due to heart disease also, so pursue a cardiac catheterization. I've even had some people who have basically done well on everything: normal stress tests, normal echo, blood tests are normal, and EKG is not concerning. If you're still having chest pain in long term, then I typically follow up with them outpatient, and if they're still having pain and discomfort, then we still pursue a cardiac catheterization. I'm gonna take a little bit of a break to be able to answer any questions that anybody may have regarding the heart, chest pain, or anything else. So let me know what questions do you guys have. For those of you guys who are just coming on, we were just talking about chest pain, but leaving the floor open for any potential questions that you guys may have regarding chest pain and things that we look for, things that make us nervous in regards to someone presenting with chest pain to the hospital or to the office. Any questions, guys, regarding chest pain? Any questions? Can you actually die from air in your IV? Potentially. Thankfully, I haven't seen anybody attempt to do that at my hospital, but there's a lot of things that both intentional and unintentional can harm someone when it comes to your heart, when it comes to your health overall. Wrong medications, wrong dosages of medications. I've seen someone that was supposed to get 10 milligrams of a certain medication ended up getting 100 milligrams of it. So there are a lot of ways that people unfortunately can have adverse um, events that occur due to medical error. Keep the questions coming. Once again, if people are just logging on, people are just hopping on. This is Dr. Isang Anthony answering questions regarding the heart health and ways that we can, live longer, prevent, heart disease from happening. And for the people who are new, everything revolves around just understanding what the risk factors for heart disease are. Things like hypertension, high cholesterol, strong family history, smoking, diabetes, I already said high cholesterol, but diabetes are and not following up. A lot of sleep apnea. A lot of people have underlying medical conditions that they don't know about, and unfortunately, that can increase the risk of having heart disease, increase the risk of having heart attacks. Advice for IMG aspiring to be an interventional cardiologist: you gotta, you gotta scale it back, because are you currently in medical school or are you in residency? If you're in residency, doing the best that you can do in residency, making sure that you shine in residency, making sure that you get as much research as possible in residency. It's easier to get into interventional cardiology than it is to get into general cardiology. So the first step is going to be getting into a cardiology fellowship, and what they're looking for as an IMG is going to be a lot of research. Honestly, that's going to be the deciding factor, is just getting as much research as possible and making contacts. And these contacts can be from anywhere, from LinkedIn, from to YouTube, to all forms of social media. But going to the conferences also is going to be a big help too. So just doing applying for match. I'll be applying for the match for interventional or general. Because if it's interventional, a lot of, I don't want to say it's easy, but it's not impossible compared to other specialties and the competitiveness of it. So good luck, Marwan. I hope you match, and not even I hope you match. I know you will match. The biggest thing is just not giving up, because it sounds like you really want to do interventional cardiology. So just go after it, and I think you're going to be successful. Any questions? Any more questions? So, in the topic is about chest pain, and there are a lot of things that can also cause chest pain, but it's not directly the heart. So you can have pancreatitis that can sometimes have epigastric pain, so a little bit lower. You can have cholecystitis with the gallbladder. It usually causes left-sided, no, right, right-sided chest pain, but it radiates to the backs. Sometimes associated with food ingestion. So, especially foods that are high in salt, spices, processed foods. So, you can have costochondritis, inflammation of the sternal wall. You can have myocarditis or pericarditis, which is inflammation of the myocardium and pericardium. A lot of times that can be due to a potential infection or both bacterial and viral. So there are a lot of things that can also mimic chest pain that is coming from the heart when it's not really the heart, especially things involving the GI system, things like reflux and GERD. Applying for IM. Good. Let's go. It is a long road, but it also goes by pretty quickly. You know, medical school was the longest. Um, Residency was the best 3 years of my life. Fellowship felt like it was 2 days. So enjoy the process because you're never gonna get these time back. A lot of times, the only thing that I have now is my memories of the times and the struggles. So it seems like a long way, but at a blink of an eye, you'll be where you want to be. So good luck with the match process. Apply smart is going to be the biggest thing, and let it be guided by your board scores, your step two scores, and the work that you've done to get to where you deserve. And if anybody gets any benefit for this, yeah. Forgot what I was saying, but yeah, if anybody gets any benefit from this, appreciate a subscription. But for that may not be for everybody, but just liking this live to hopefully bring more people inside to answer any questions you guys have. For the people who are joining, I'm answering questions regarding the heart health and prevention. We've been talking about just um, heart disease, chest pain, and what chest pain is, things that can cause it, things that can mimic it. So just trying to answer as many questions as possible. Excuse me. All right, any questions? As much as possible, I'll answer it. But we've been talking about chest pain. We can kind of switch the gear a little bit and talk about, heart disease itself. Heart disease has many forms. We have, heart attacks. We have itself hypertension. We have heart failure. We have cardiomyopathy, enlargement of the heart. A lot of it depends on the ejection fraction. So if someone is not feeling well, they may have cardiomyopathy. So we evaluate this with an echocardiogram first to see, is the heart squeezing appropriately? If the heart is not squeezing appropriately, is it due to the squeeze itself? Is that down? Or is it due to potential heart being stiff? If it's due to the heart not squeezing appropriately, systolic heart failure, we have to ask ourselves, has this person had a heart attack? Is that heart attack preventing the heart from squeezing well? We further investigate this with cardiac catheterization to make sure it's not due to that. On the other hand, if the heart's squeezing well, but it's very stiff, so blood can't collect in the heart because it's so stiff, so it backs up. It can back up into the legs, causing pitting edema. It can back up into the lungs, causing shortness of breath. It can back up into the stomach, causing weight gain. Early society, you eat and get full pretty quickly. One of the biggest causes of diastolic heart failure due to the relaxation is high blood pressure. Can also be due to COPD, but can also be due to sleep apnea. So, getting that echocardiogram is one of the first steps that kind of lets us know which way to go towards the management of the individual. Is it due to blockage that we need to fix, or is it due to lifestyle changes that we need to fix to control the blood pressure a little bit better? I graduated from nursing school and went straight to working on surgery. Scrub nurse trauma 1. Let's go. Congratulations. I think it's Janelle. Congratulations with that. And one of the things that needs to be just discussed is just the importance of everybody. I can't do my job without a great nurse. I can't do my job without a great PA, without a great CRNA. So, thank you for what you were doing, showing up each and every day. Like, since 2019, 2020, working in the medical field has been very challenging, has been very difficult on certain cases, but we just keep showing up, and thank you for doing this while the toughest times that our country has faced, able to make it through it, and on one of the more, I wouldn't say they're all difficult, they all have their own challenges, but I have a lot of respect for the nurses that work on the surgery floor, so thank you. For the people just hopping in, this is Dr. Isang, answering questions regarding heart health and prevention. We've talked about heart disease in different forms of chest pain. Haven't done high blood pressure yet, but chest pain and just heart disease, heart failure, the different types, systolic, diastolic. Now just answering questions as much as I can. I like to. So this one, Brandon S says, just scrolling through YouTube lives and stumble across yours. I start pre-nursing school on Monday. Turn up, let's go. Like, it is a grind, just in the medical field itself. There's a lot of things that you're not going to know, you're not going to understand, but with time, with dedication, you're going to do it. We need nurses. We need you guys badly, and with everybody, we need to understand the stresses that are associated with it, but to be able to separate work and home, so being able to have a good work-life balance. So when you're done with nursing school, I want you to get a job that fits your work-life balance. The last thing you want to do is go home and still thinking about work, or at work wishing you were home. So congratulations, more importantly, and I think you just made one of the best decisions. And it wasn't an easy decision. It wasn't, so congrats on many levels. I'm gonna give it about 8 to 9 more minutes to answer anybody's questions regarding heart health and prevention. We've talked about chest pain and what makes me concerned. Let's go. Been out of school for 13 years, but spent last month brushing out biology, chemistry. Feel very. Let's go. Congratulations. Congratulations on being able to come back after such a long hiatus, being out of school. After I finished residency, I was a hospitalist for 2 years. One of the hardest things was to go back from being a hospitalist, a working paid doctor, to a cardiology fellow. Working paid doctor, just significantly less. Calculated it, my salary dropped by like 83.333% um, when I became a fellow. So for you to have been working for such a long time, to be able to go back and learn all that information is just amazing. So congrats. I find it interesting the differences that men and women show when it comes to heart attacks. Absolutely. I think one of the things that we have to realize is that when we describe heart attacks, all these research that we have on heart attacks were made predominantly on men. So in men, so it's unfair for us to use that as the criteria for every single person. And I will say that women also have those classical symptoms. Chest pain here radiates to the arm, can associated with stress and exertion, and gets better with rest or a medication called nitroglycerin. But sometimes we have to realize that women diabetics and people with kidney disease can sometimes have atypical presentations. We used to call it atypical chest pain. Unfortunately, by doing that, used to make it less appealing and people wouldn't pay enough attention. So now we've changed it technically to possible chest pain. So yes, women can have those atypical features, and it doesn't have to be chest pain. It can be shortness of breath, uh, dyspnea, shoulder pain, elbow pain. If something is new that you're not used to, go get seen. It's the biggest recommendation. And if everything so far looks good in the hospital, follow up with your medical provider, because sometimes they may want you to still see a cardiologist and get the appropriate workup to make sure that you don't have a heart attack. I've had a lot of patients over the past few years pass their stress test, pass an echo, labs look good, EKG looks good, and then we pursue a cardiac catheterization because they're still having residual symptoms and they end up having heart disease. So it's always important to remain vigilant in regards to your health, especially your heart health. Yeah, Brandon, with those symptoms, you definitely want to go and see your medical provider, because it can be nothing but, once again, people can have different presentations. One of the things I always, have to remind myself is that, you know, we read the books to learn about patients, but patients are, and their experiences is what ends up writing these books for us. And each patient has different experiences and may not make it on the big chapters, but, you know, your discomfort, your questions, the things that make you nervous needs answers too. So if you feel obligated, I would definitely want you to, just seek a little bit of care, whether it's just getting an EKG or a treadmill stress test for peace of mind. Oh, let's go. We got a dad joke. Why do ducks have feathers on their tail? Why? And I'll end it with my dad joke too. Once this person to cover their butt quacks. Okay, okay, okay. This is gonna be mine, and then I'm gone. How do you find Will Smith in the winter time, specifically when it's snowing? How do you find Will Smith in the snow? I hope you guys know who Will Smith is before. You look for Fresh Prince. Oh, that was bad. You look for Fresh Prince. And people who don't understand, Will Smith had a TV show called The Fresh Prince of Bel Air. Bel Air. So that was it. Thank you, thank you. I know, keep my daytime job. But that was it for today. Thank you. Yo, y'all my heroes. Enter a name, Brandon S. and Janelle RN. So I appreciate, make sure I'm not missing somebody else. I appreciate you guys for stopping by. Once again, Dr. Isang, here to talk about, heart health and prevention and also an occasional dad joke. Thank you guys for giving me this opportunity, and I am out of here.